Abnormal pap smears or cervical screening tests, primarily due to the HPV or human papillomavirus, but sometimes there are false positives where the cells are abnormal because you have an infection or an inflammation within the vagina, and that can make the cells look abnormal. The thing to remember about these false positives is that they're usually not associated with the presence of the HPV virus, and they usually resolve with time. If someone has an abnormal cervical screening test, they're usually referred to a specialist gynecologist for a test called a colposcopy, where we look at the cells of the cervix using a digital microscope. So we actually have the equipment that we use. You'll come into this room, you'll be left to get changed into a gown. You'll sit on this chair, which is quite comfortable. There'll be a nurse present to support you and to help me with the procedure. You'll never be left alone. We cover you with a blanket so that you feel more comfortable. And then we use this digital microscope to visualize the cervix. Everything that comes up on the digital microscope is shown on this screen, and you may or may not choose to look at your own cervix, but we can point out the abnormalities on the screen. You may need to have a biopsy. If there are abnormalities that we're concerned with, after we paint your cervix with acetic acid or ordinary vinegar, then we would take a biopsy with an instrument, and this is a relatively painless procedure, but allows us to come up with a definitive, exact diagnosis. That diagnosis can be one of three things. The first thing is you may be normal, and the biopsy shows no abnormal cells at all. And in the presence of the HPV virus, we would then suggest we need to meet you again in 12 months' time. The second possibility is you have low-grade changes or less severe changes on the biopsy. And this again suggests that we just need to see you again in 12 months' time. It's important to realise that if you have low-grade changes, the most likely outcome is your immune system will clear the virus, will clear the abnormal cells, and over often a number of years, you'll return to normality completely. The third possibility is that you have what are called high-grade changes. High-grade changes means the cells are significantly abnormal and you need to have treatment. And that treatment is usually a procedure to loop off the abnormal cells with an electrical wire device under a general anaesthetic. And in the vast majority of people, they are totally cured and never have an abnormal pap smear again. If you're due for a cervical screening test and you're pregnant, you should go ahead and have it. There's no risk to yourself or the fetus by having a routine cervical screening test in pregnancy. And if your cervical screening test indicates that you need to have the colposcopy test that we discussed, that is also safe to perform in pregnancy because we're just visualising the cervix. We're not doing any procedure to interfere with the welfare of your pregnancy. Abnormal pap smear really are almost exclusively due to the human papillomavirus. So people often worry that they've been stressed, they're eating the wrong food, etc. And that is not the case. It's the presence of the virus, which is present in millions of Australian women, that is the cause of abnormal pap smears. We do know, however, that smoking increases the risk of having an abnormal pap smear and actually having cancer of the cervix. It's important to seek the appropriate treatment for abnormal cervical screening tests because otherwise you may, over a number of years, progress to cancer of the cervix. Having your cervix assessed if you have an abnormal pap smear is a preventative way of looking after yourself and avoiding further more serious disorders. If you're not having any symptoms, then cervical screening tests are performed every 5 years. However, if you have a history of human papillomavirus or you have abnormal symptoms such as abnormal discharge or abnormal bleeding, then you need to have cervical screening tests whenever you have those abnormal symptoms, and follow-up may indicate that you need to have your cervical screening tests more often. I've never seen a cancer in a patient with an abnormal pap smear. The worst and that is in over 30 years. So the worst that I've seen is a patient with high-grade changes who's required a surgical procedure. If you're having regular pap smears, it's extraordinarily unlikely that you'll develop cancer of the cervix. The people who develop cancer of the cervix are usually people who walk into our office, say they've been having abnormal bleeding, especially bleeding after intercourse, and they haven't had a cervical screening test. In other words, they've ignored the usual precautions of having regular cervical screening tests. If you're under supervision, I believe that your chances of developing cancer of the cervix are 0.